Sharad sir?
Yes, please. Very good evening. Shall I start?
Yes, sir. Go ahead.
Can you get his?
Yeah.
Please get his PPT up.
Good evening, everyone. Chairpersons, Dr. Dayanand Noli, Dr. Anupama Pujar, fellow ASI members, postgraduate students, and undergraduate students if they are. At the outset, let me thank the Karnataka State Chapter for having given me this opportunity to speak on a topic which has an air of taboo around it, whether early retirement is an option for a surgeon. Next slide, please. When I retired sometime in August 2020, young surgeons and colleagues together would express, hope I wish to follow your footsteps, wish I could opt for decisions like you. We feel we should also take a call like this. These were the random expressions when I retired and made it public. There is a definite undercurrent, which is aspirational in nature, to seek early retirement. An unexamined life is not worth living. This topic is addressed to a small niche group of professional surgeons. It is not for surgeons who belong to the top 5 to 10 percentile of surgeons who have made choices, they are happy with it, and it's working with them. At the opposite spectrum, we have a group of people, that is the majority, 75%, who feel that thinking is craziness. They just fit in the peer group and go along with the majority of the peer group. This leaves behind a small group of people between 75 to 90%, that is about 15%. These are the group of surgeons who, for some reason, have a potential, leadership potential, much beyond what they are doing now. But they are struggling to fit in the peer group. These are the people who keep struggling. A situation arises where conflicts keep increasing, and it is something like it takes a slow form of suicide or otherwise. This group is a minority group. So in sum and substance, this thought process is not going to be a mainstream thought process. It will cater to give a window of thought for people who are aspiring, who within their heart feel that at some point of time, they should be seeking to do something which is different from what they're doing now. The spectrum of early retirement will be defined, and it does not necessarily mean just retirement and do nothing. Next slide, please. Like any paradoxes of life, I'm confronted with a situation where I'm talking about early retirement to young postgraduates in the audience. But let me assure you that each group in the audience will be able to get something out of this topic, which will enable them in the decision process. Next slide, please. Let me make it very clear. When I talk about early retirement, there should not be any iota of doubt with respect to the glory of surgical profession. Even today, surgery is a branch of medicine wherein it stands high in the hierarchy with respect to the different modalities of treatment. Only when other modalities of treatment are not amenable, ineffective, they land up with surgeon. Next slide, please. Next slide, please. Now, our profession per se is bestowed with or empowered with the ability to make a change directly to the patient, not only in extirpating this disease, but also elevating his agony. Next slide, please. Next slide, please. Now, this is a clinical situation which each one of you will be familiar with. There is a patient who is malnourished with bone and skin, the chest rib indrawn. He comes to you with chronic pain abdomen, some things with signs and symptoms suggest to have chronic obstruction. You diagnose it most commonly a sort of tubercular abdomen, and then operatively it turns out to be a chronic perforation with dense adhesions. You do an appropriate surgery to this patient, and within 8 weeks' time, you see a radical transformation from the state he comes 8 weeks ago and from what he is today. This type of gratification can never be obtained elsewhere. That is the glory of surgical profession. Next slide, please. In an era where most of the life or professions at large have impurities which are increasing, but still we should be happy that surgery or medicine per se is still the most trusted profession across the world. Next slide, please. Next slide. Now we have just a depiction of how extreme and passion towards the profession can be. They value the profession so much that someone opts to become medicine. A lifelong ambition to become a doctor happens at 56 years. A doctor who goes much beyond the structure of his regular treatment process. Next slide, please. This is not a very uncommon situation where we hear expressions like a 70-year-old surgeon saying, "I plan to die treating patients." Contrasting that, a surgeon retires at 55 years by avoiding the normal traps. The bottom line in this instance would be that for each their own. Everyone is right according to their experiences, according to their situations. It is for you to determine what are your personal goals. And if there is a need, at least to give a thought process, get a perspective, get a food for thought, whether there are any other options which would enable me to have the complete manifestations of my capabilities. Next slide, please. Now, when I talk about early retirement, I did say that I don't mean early retirement is do nothing, retire and do nothing. That is not the meaning of early retirement. What it means basically is to get freedom, to seek freedom from something which is very much bounded to you. When we talk about early retirement, it could be an option for alternate medical careers. It could be an option for mid-course change of lane, something from a fast lane to mid lane or a slower lane, depending on what suits you. Voluntary retirement from malaligned positions, switch in profession, and something which is the ultimate is seeking freedom and independence. And time is a most essential element out of this. If you are able to get time, most of your issues are solved. Next slide, please. Now, when we talk about a topic which is like this, not a very uncommon topic, unconventional topic, we look for what are the situations across the globe. Are there any papers published on this? We hardly find scientific papers on this topic of early retirement across the globe. You have a lot of literature about early retirement in doctors, surgeons, multiple forums, but scientific literature somehow seems to be lacking. Recently in BMJ, in the year 2021, there was an article which published and which was titled like doctors seek early retire. The number of doctors seeking early retirement has tripled since 2008. Somewhere around that same time, probably acknowledging the ground situation, the president of the Royal College of Surgeons did express as an open letter expressing concern regarding early retirement figures. Next slide, please. So what makes surgeons to seek early retirement? Many options. They are personalized based on this. I just try to categorize few of them. No longer surgical practice per se is a solo practice. It is not a small enterprise that it was earlier. We have seen a radical change with respect to group practice and, more importantly, corporate practice. That what I mean is a hospital which is run in the structure of corporate. You are now managed by the hospital management group. You are given assigned targets. You need to market. You become a commodity. The regulations don't seem to abate. They keep increasing. Our defensive practice is again ever increasing. It is always medical legal based angled practice which we are compelled to practice. Stress in surgeons, a known entity, early burnout, and low morale, which leads to emotional illness, in few instances suicides. Recently, we got a letter from our ASI president, Dr. Siddesh, talking about menace of middlemen in medicine. That is nothing but the manifestation of surgeons becoming a commodity. We are losing our pivotal position and the strength and the honor which was associated with the profession. Slowly, it is waning away. All of these are occurring not acutely, not over a period, rather in immediate aftermath. They are taking place slowly, but the situation seems to get acute in recent times. Next slide, please. Now we talk about stress, that is the inability of an individual to adjust to the prevailing situation. We talk only more often with respect to what happens to the individual who has the stress. What are the behavioral responses it can give rise to? But at the same point, we also would realize that the stress in the surgeon gives rise to outcome effects as well. There is intellectual impairment, poor concentration, lack of judgment, lack of creativity, and complication rates are high. Next slide, please. Now, all this time, again, conventional teaching has been, we shall do a balancing act. But let us try to realize that in the present situation where accessibility of patient to doctor is very high, where we have become commodities, every specialty, every branch of stream of profession has its own requirement. It has its own tenets of practice. They are not compromisable. For example, we take conventional teaching of competency, compassion, and credibility, the three pillars of practice. When this imbalance starts happening, that is the area where you see there is a rise in conflict. These are not going to change because the patient is going to be a human. The diseases almost are same. What is changing? Only the treating doctor. So it is a psychological play. So are we able to really balance? And the other point of is, even if you struggle balancing, I've seen that you almost land up negating all the goodwill which you have created over the last 20-25 years by practicing at will. So these are the points which should make us ponder whether really is there any scope for so-called balancing act. Next slide, please. We take our job seriously. So whenever I was the unit chief, from the time I became unit chief, we had some sort of a loose protocol, put on pen on paper, communicated to the post graduates and the staff as well of what is expected in the unit. Next slide, please. Now, coming to the why this is a topic which becomes, or this is an issue which becomes difficult to treat and difficult to make a choice. Now, often we talk about surgical audit, medical audit. We never talk about self-audit. We don't have time or space for self-audit. Unlike earlier, we are plenty of opportunities. Like earlier, our vision was a tunnel vision. Medicine, you start practice more often, you start your practice at the place where you want to settle, and you practice for whole span of 30, 35 years or whatever duration is. This is a very stereotype one that no longer is there. Migration is common, shift in the professions are common. When other professions can shift, why not medicine or surgeons can shift? The most important thing is doctors who switch or retire early often meet with scorn. There's sort of social expectation from people. There are discussions about ethicalness of retiring early. And since because of the tunnel vision, somehow they have not made an attempt to see that their other skills, other blessings are not upgraded, and there's little career planning. Next slide, please. Now, this is a slide which shows we have heard something called as Maslow's theory of needs. It's a hierarchy. It's a different levels which a individual human being would like to get satisfied or fulfilled in his lifetime. We have made a choice somewhere which was right judgmentally at that point of time, but over time, the popularity and fulfillment from the surgeon's perspective also follows a cyclical pattern. It is not bound to be status quo. So, and our thinking is restricted only to the basal level of being satisfied with our requirements. We are not growing beyond to the higher layers of motivation, higher layers of thought process, and etc. Next slide, please. Now, having said this, we are somewhere here. I think most of them realize may not be open, but there's an undercurrent. Most often, somewhere something is amiss. They may not be able to pinpoint, but something is amiss. So we have come to a stage where something is, we are accepting it. We feel that there's a window to explore something. We need to take it further and bring it to a responding mode. Next slide, please. It is not by default things happen. It is only by design. Formal action is needed. Now, from the institutional perspective, I have 2 points to communicate. One, we as an individual, we are blessed with various intelligences. Gardner talks about 9 intelligences. It is not that we are blessed with only one compassion, skill, knowledge-based workers. We are having many blessings as such. Each one is having different blessings. We have no opportunity for them to manifest in our traditional way of practice. That is where there is a role for electives. No longer, earlier we never had these electives. Now in undergraduation, we hear about electives being talked about. In Western world, electives are an option. It is not that you restrict to one area only. There are integrations of other streams so that you can explore that occasion whenever it happens. So it's a multidisciplinary outlook. Now, when we talk about this one, as a professional associations, now we talk about stress so much. When Western world, for example, GMC in Britain and AMA in American Medical Association have recognized that stress is a very valid point with respect to the medical profession. There is a working pattern for all the consultants and doctors there. No one works more than 8 hours per day. With us, if you are an operating doctor or a doctor per se, you are 24/7, 365 days responsible for that patient. This is where our associations can come and create a sort of group pressure group from a pressure group to see that some modifications take place. Most of our NMCs and NMC, earlier MCI, were only restricted to formulating the admission process. They are very less concentrated on the concerns about the doctor. What we need to look at is we need to have a food for thought, choose one unique path towards freedom, be courageous, and dare to act. Next slide, please. Next slide. Now, what are the other options? Let me not go into the details of it. Entrepreneurship, enterprises. rather than wanting to or landing up in a situation where you need to work in a corporate structure governed by the management trainees or management group, why don't doctors themselves together come and start, and one person can take the lead of managing an enterprise? So a doctor is very much comfortable working in another doctor rather than the corporate sector. Medical legal is one thing which is small area, niche, not much. Startups, industries, they are taking a big leap. We know many people among ourselves, we are all, some of them are tech savvy guys, some people are coders. Why? They also, actually, when we had a conference at Bagalkot last time, we had IIT guys coming and looking for options where they want to collaborate with surgeons so that some innovation could come up, startups could come up. Rajiv Gandhi University also had an occasion to start some innovation hub in its premises. So something like that should start that should give an opportunity for people to explore. Next slide, please. What are the consequences of early retirement? One important thing, please remember that just to financial freedom and early retirement is not a solution for everything. One should be very clear of what is that he wants to do after retirement. If I talk about early retirement, there are various other options which I will not ponder now. But they should be thinking what is that specifically they want to do so that things will start becoming easier. If they have issues which are beyond that, they need to be addressed earlier rather than seeking early retirement first. Have a trial of it. Try to find out whether things suit you or not. Otherwise, what will happen is you are likely to get bored, you're not likely to be happy, and then you start having self-doubts about yourself. Please remember, small things which are always compromises, sacrifices are bound to be there. People will keep talking whether you are a misfit or etc. Or sometimes also there will be dilution in your professional identity per se. Next slide, please. Next slide, please. Now, when I talk about these things, I just want to highlight 2 or 3 quotes which will enable you to think. One should have a clear idea how much time do I want to become a leader in the specialty. Because as I said, these are the group of people, 5 to 10%. They are in the top percentile. They are blessed. They will do things which is working with them. Is it that you belong to that group? How much time do you want to devote to other domains of your life apart from profession? When do you want to start? Success which costs you too much must be considered to be failure. Success is being able to spend one's life your own way. There will always be a conflict whether to listen to reason or follow one's passion and make personal goals a priority. Next slide, please. Now, we come to a situation where there is a maxim. A surgeon should know when not to operate, more importantly than know when to operate. If you extrapolate it here, a surgeon should know when to stop operating. The 2 important points which I want to tell you is when one's patient starts developing unusual complications after an ordinary procedure and losing temper frequently during the procedure are clear indications that something is amiss and you should be contemplating whether you are the right guy to seek retirement early. Next slide, please. Next slide. Now, in conclusion, let me tell that early retirement is not a sort of an illusion. It is a very feasible mission which just needs a good amount of planning, some personal sacrifices, and keeping the personal goals as a priority. Thank you, one and all.
Sir, thank you. We'll go for question and answer session, sir.
Yes, please.
Some chat box, you can see Professor Godi is asking, in the West, the maximum surgeons are retiring to avoid medical malpractices. What is the incidence of in India, he's asking?
Sir, is it with respect to the number of instances where malpractices cases are filed?
No, they are afraid of malpractices. That's why they are early retiring in Western world. What about India? He is asking.
In India, there is no literature. If you log in the keyword of retirement in any surgical scientific literature, you do not find a single literature talking about early retirement. We have no study with respect to the Indian figures. Or for that matter, even the Western world also.
And Dr. Ramakrishna wants to ask, can you please give some anecdotes of surgeons who retired and doing what are they doing now? Some examples. I think you should tell about yourself, sir.
Now, let me, okay.
Yeah.
It is a personal choice. I tell you, many people would realize that if you form groups which are beyond, for example, now my 3 pillars as of now are making myself a better version, having spiritual pursuits, literary interests. Third one is equity investment. Roughly, this will also include the traveling and the backpacking part. Now, if these are my areas which I have my focus, my most whole of my day revolves around this. You will be surprised that when you form focus groups of these entities which you are interested in, some could have photography, some could have trekking, high mountaineering, etc. You will find doctor forums, which are, you will not get these people among you amidst yourself. You are going to be a sort of path breaker. But you will, if you take examples, doctor groups, trekkers, you will have plenty of them who are serious trekkers. You have doctors who are equity. It is overflooded. Equity forums where it is exclusive for doctors, you will be surprised. Many people would not come open. Some of them are in the anonymous group, but they are actually involved in trading process. So likewise, depending on what makes you comfortable, what makes you more happier is what you need to opt for. I don't think we will be looking for anecdotes or examples per se, and that is what I can tell. But probably I should start making a list of people who have made similar decisions.
And what about private practitioners, sir? Dr. Naj wants to ask. A private setup is there. What is the option for them for the early retirement?
And Dr. Naz, you should decide. You are a very creative, poetic lady. You should decide of what makes you, what is your purpose, and what will make you happier to get involved or give more amount of time. So that is what I can tell you.
Any other question?
So when do you think you should plan retirement? Is at what stage in your active career should you start planning your retirement?
So this depends roughly on what is the reason for your retirement. Is it that you are seeking a different option? Is it you are looking for an alternate medical profession? Are you looking for a startup enterprise sort of thing? This is what will determine. For example, which is more often directed here, if you are looking at just so-called only early retirement, it is at the age of 55 to 60. All those people who start to retire around 55 to 60 years are the age group. Are they someone who have fulfilled their wishes, professional wishes, who have had an exalted career by their own standards, and then they are looking for something else. It is a sort of a mature decision. But at every age group of 30, 35, 40, 45, there are different reasons why you should opt for. For example, if you are looking for a startup, obviously you would like to start a career much earlier, sometime in the 40s. And Dr. Lakshman, I would wish to that you put in few words, because I know you are a technological guy, technical guy, tech guy, and then you are somehow, you have interest of startups. Have you come across, I have come across people who, engineer friends and otherwise, say that why don't you join us, let us start having a startup, something related to the medical fraternity. What is your view on this?
Certainly, if you have the financial backup for that, if you have the financial security, having anything related to medicine but a private entrepreneurship, I think is most welcome. I will be a devil's advocate and put you in a spot deliberately with no bad intention. One view should be, that surgeons are highly skilled. And you don't have, even though there are many surgeons around, but you have your own skill and you can really contribute to society. So if you retire early to pursue your private interests, are you not depriving society of your specialized skills?
Yes and no. Yes, your point of argument narrative was right. That is what is the conventional teaching. When an engineer is also a highly skilled person, he is graduated from IIT, he is graduated from IIM. When he joins, he has a startup which is not related to engineering. When he ventures into management, which is not his focus area of engineering per se, when he can enter politics, when he can do things which beyond much earlier. Why this taboo only with medicine people? We have self-drawn.
Yeah, fair enough.
Dr. Gurshantapa, last
Sharad,
question, sir.
Arvind Patel here.
Yes, please, sir.
Sir,
I'm very happy because someone is there with me. In fact, at the age of 58, I announced that I'm phasing out.
Okay.
So, of course, Corona has helped me to take that decision. Anyway, thank you. And this particular thing, if you at least early, take out that early retirement, whatever it may be. Early means somebody might question why early. So otherwise, retirement for surgeon or doctor, I still feel it's required and it's a good food for thought. Thank you.
Thank you,
Dr. Gurshantapa, sir,
Nuri,
quickly.
sir.
Yeah, please.
Sir, in continuation with Dr. Lakshman's opinion about early retirement, if a good surgeon, society will be deprived of. Same thing, I think if a surgeon is a good teacher who can teach many, not joining a teaching institute and exclusively submitting themselves for a private practice. And at the age of 50, 55, thinking that they want to teach medical students. Probably if they would have started joining institutes in the early age, many hundreds, thousands of students would have been benefited.
Thank you, sir. Prime Minister has given a call for up to 65. Anyway, Dr. Siddesh, President, your remarks last, because we are running short of time, sir.
Thank you, Dr. Nuli. Short, crisp comment. See, for me, retirement from surgery means when I can be more dangerous to the patient than what I am right now. So if I feel my patients are at threat of continuing to operate, that is the time when I will quit. And well said that, I will tell you, at the age of 53, I felt what happens to me after 60. So that is what made me to start the hospital of my own. You see, understand, it is not for anything else. I wanted to continue operating after 60, which I might not have been possible for me to cater the middle class and low middle class, which are my clientage. If I had not, I have been forcefully given a termination from my institute before 60, or rather maximum by 60. So that started haunting me at the age of 53. That is when I took a decision, I need to have my own platform. So I think each person has his own age timeline. It is up to us to realize it quite early so that we can plan your retirement. So that is what we should not feel people have retired at the age of 55. They are quite happy. They are quite contented. I'm happy for them. But you have to realize what is good for you and your mind at that particular stage. Thank you.
Thank you. Dr. Anupama, last words, and we'll conclude this session.
Thank you, sir. It was a great talk, and we got a lots of ideas from you. And I thank the organizers committee and also Dr. Siddesh sir for coming in and putting your valuable input. He is my teacher also.